Abnormalities of head size and shape. Microcephaly. Indicative of small brain size, head size. Definition: head circumference of for age is less than -2 st, low value. True severe significant microcephaly, head circumference for age less than -3 st. Less than -3 st, pathological. Etiology: primary defective brain development, genetic defects. Trisomy 12, 18 and 13. Comelia de Lange syndrome. Eyebrows are joined in the middle, synorphis. Trisomy 12, 13 and 18 and 13. Rubinstein-Tavy syndrome associated with broad thumb. Familial microcephaly, autosomal recessive inheritance. Secondary external factors affecting brain growth: maternal factors, torch infections, toxins, alcohol exposure, drugs, phenytoin, radiation exposure during pregnancy. Perinatal factors: birth asphyxia, other CNS insults, trauma, injury, infections. Phenylketonuria, deficiency of phenylalanine hydroxylase. So phenylalanine decreased phenylalanine hydroxylase. Otherwise, the product is tyrosine, which is also decreased. Decreased melanin, decreased hypopigmentation in hair, skin, and eyes. Converted to other metabolites like phenylacetate, phenylactate, phenylpyruvate, which causes mousy, musty urine odor. Increased phenylalanine causes brain damage, microcephaly, and seizure. Microcephaly due to teratogens. Fetal alcohol syndrome. Facial characteristic: microcephaly, small eye opening, smooth philtrum, thin upper limb. This is fetal alcohol syndrome. Phenytoin diphenylhydantoin exposure. Most commonly ventricular septal defect, fetal hydantoin syndrome. Cleft lip and palate, microcephaly, cardiac defects, hypoplasia of nails and phalanges. Late onset acquired syndrome, noticed during development period of the child, not at birth. Rett syndrome. X-linked dominant inheritance. MECP2 gene defect. Normal head size, microcephaly after 1 year. Features: development regression, loss of previously acquired milestones, abnormal midline hand movement, occurs in females. Hand wringing stereotypic movement, characteristic abnormal hand movements in the midline. Speech defect, progressive ataxia, wheelchair dependent by adolescence. Seckel syndrome, bird-like face and beak-like nose. Angelman syndrome. Macrocephaly. Definition: head circumference for age is more than 2 st. Etiology: fluid in the brain, hydrocephalus. Hydranencephaly, complete replacement of brain tissue with fluids. Transamination positive. Thick skull. Hemolytic anemia, extramedullary hematopoiesis, expansion of the skull. For example, beta thalassemia major. Achondroplasia, osteopetrosis, increased brain volume, megalencephaly. Metabolic disorders, lysosomal disorders. So this is, we are looking at megalencephaly, that is increased brain volume. In that we have metabolic disorders, that is lysosomal disorders. The first one is mucopolysaccharidosis, and the second one is GM2 gangliosidosis. In lysosomal disorders, you have your mucopolysaccharidosis, and second one is GM2 gangliosidosis. In GM2 gangliosidosis, you have Tay-Sachs. So Tay-Sachs is hexosaminidase A deficiency and cherry red spot in the macula. No hepatosplenomegaly. Leukodystrophies like Alexander disease and Caravan disease. Sendhoff hexosaminidase A and B deficiency. Cherry red spot in macula. Hepatosplenomegaly is present. Sendhoff. Hexosaminidase A and B deficiency, cherry red spot in macula, hepatosplenomegaly is present. Genetic syndromes. Soto's syndrome, cerebral gigantism. Soto's syndrome. Neurofibrosis type 1. Fragile X syndrome due to CGG trinucleopeptide repeats. Long face, long ears. Macroorchidism. Non-syndromic. Familial megalencephaly. Most common type and cause of megalencephaly. Coming to craniosynostosis. Abnormalities of head shape. Cranio is skull. Synostosis is fusion of sutures. Premature fusion of sutures. Normal fusion of sutures. Metopic suture fuses before 2 years of age. This is the metopic suture, 2 years of age. Coronal suture, sagittal suture, lambdoid suture fuses before second decade of life. Rule. Suture fusion, skull growth arrests perpendicular to suture line. Skull growth occurs parallel to fused suture. Common sense. So let's learn the shape. First suture, that is most common suture that is involved in craniosynostosis, is your sagittal suture. Premature fusion, AP expansion of the bone. This is called dolicho. It's called dolicho. And syphilis in all the words, so just remember, elongated skull is dolicho. Brachycephaly. Here your coronal sutures is fusing. This type of skull where transverse elongation is called brachy. First long skull is dolicho, broad skull is brachy. Plagiocephaly. Here only one unilateral fusion of coronal suture. Unilateral elongation. Normal side appears flat. That is plagio. Only one side broadening, plagio. And then metopic suture, that is fused. It will elongate in the anterior aspect. That is trigon. So dolicho is a long skull. Brachy is a broad skull. Plagio is one side broad skull. And trigon is long in the front. Oxycephaly and turricephaly. Premature fusion of multiple sutures, hence irregular shape of the skull, no shape at all. That is oxycephaly or turricephaly. Oxycephaly. So oxy and turri, irregular. Associated genetic syndromes, Crozon syndrome and Apert syndrome. Both are autosomal dominant. Crozon is associated with brachy, which is wide skull. Apert is associated with Turi, which is irregular skull, and a specific tower-shaped skull is seen in Apert syndrome. Features of Crozon is exophthalmos, hypertelorism, maxillary hypoplasia. All the symptoms like exophthalmos and hypertelorism is due to shallow orbit. IQ is normal in Crozon syndrome. Also in Apert syndrome, also you see exophthalmos, not that prominent. You see syndactyly, fused fingers, and mitten hand deformity, and low IQ. While Crozon was normal IQ, this is low IQ. So here you have your Crozon and Apert syndrome. This baby is suffering from Crozons. He has exophthalmos. This baby is suffering from Apert. He has a tower-shaped skull. Apert syndrome also has syndactyly. Carpenter syndrome. Autosomal recessive. These were autosomal dominant, both of them. This is similar to Apert syndrome, but you just read that it is autosomal recessive and it is associated with obesity and hypogonadism. In our next video, we will learn abnormalities of stature.